We are. All right, everyone. Well, welcome to our July meeting for the Virginia Caregiver Coalition. We are going to start off first by welcoming our new members. So I'm just going to read through the list of names. And if you're here, just at the end, if you want to just speak up, introduce yourself, maybe say what your background is or what brings you here. So we have Lynn McHugh, Trina Flannery, Lori Coulter, Margaret Brown, Misty Lee, Julie Woods, Jamie Mills, Catherine Stoyer, Leslie DeMoss, Mary Ann Gamboa, and Octavie, Bongum Sikode. So are any of our new members here and would like to maybe introduce themselves? All right, cool. Well, we are super.
I will. Oh
yeah, go ahead, Julie. Go ahead.
I'm Julie Woods, and I live in Whitestone, Virginia. And I'm currently doing research for the Bay Center here on how we can be supportive of caregivers. So I am looking into programs and projects to see how we can meet those needs.
Very cool. Anyone else who's new who might be interested in introducing themselves?
I'll introduce myself. This is Heather Shin. I am with the New River Valley Agency on Aging. So I've kind of just been joining in and not necessarily interacting, but just listening and learning to these. So.
All right. Do we have any other new members with us today?
Yeah, this is Trina. Emily, I think I just met you.
Yes, we met the other day. That's okay.
Yep, yeah. So I'm a previous caregiver, family caregiver. I now do caregiving, coaching, and advocacy, and I also still work in the field as a private caregiver.
Awesome. All right. And then anyone else? I don't think I saw any of the other names of new people, but just in case I missed anything. Awesome. Well, again, we're super happy to have all of our new members and hope that you will continue to join us at these meetings. We're now going to go to announcements. So the first one is that Cheryl Taylor from the Health and Safety Committee at the Celebrate by Del Webb community located in Fredericksburg is looking for a keynote speaker for an upcoming Caring for the Caregiver event on September the 26th. They're looking for somebody who can deliver a 15 to 30-minute presentation on the subject. And I believe, do we have some sort of a handout, Nick? No. Okay. So anyone who's interested in potentially being a keynote speaker for this event should reach out to Cheryl Taylor at cheryl@staystrong.seniors.com. And maybe we can put that link or that email in the chat for everyone, just in case anyone's interested. The next update is a new online research study called Breaking BPSD, or Behavioral and Psychological Symptoms of Dementia, has been released by Asia Owens, who is a doctor of nursing practice, psychiatric mental health nurse practitioner student at Radford University. And this study is intended to engage caregivers of persons living with dementia throughout the entirety of Virginia. And we will be sending a flyer out for the study with today's meeting minutes. So if you're interested in participating in this study, you can read more about it there. Yeah. And so are there any other announcements besides those two about any other educational or research opportunities from our general membership that anybody would like to share with the group about maybe some opportunities coming up?
I'd like to, Emily, this is Dee, Senior Connections in Richmond. We're going to be having a caregiver training event on August 11th at the Y, which is right close to us downtown. So I will send out a flyer.
Yes, please do. That sounds great.
I can make sure that gets into the meeting minutes too, D.
Yes, yeah. Anyone else with any updates on things that might be going on?
I think everyone's on vacation in July.
I know. I wish. No. Okay, well, if that is all, then we can move to our old business and I will turn it over to Nick.
Emily,
Oh, yes,
I'll
yes.
just add this. So
Yeah.
for the Northern Neck Middle Peninsula, Bay Aging has created a caregiver advisory group. We're meeting quarterly to discuss things that we can do in our area. And we had a good turnout. We had a lot of local agencies, social services, the CSB show up. I'm meeting like with geriatric counselors to figure out how we can kind of coordinate. So if anybody's in that region and would like to join that, if you're in the Northern Neck Middle Peninsula, or if you just serve people in the region, even if you can't attend meetings virtually, we'd love to have you on the email list.
That's awesome. That sounds like a great opportunity.
Oh, yeah.
All right, last call. Anything else?
Emily,
Yes.
hi. If I could just give a little update on budget things, because I'm going to have to drop off for another meeting.
Okay.
But
Yeah, go
I just
ahead.
thought, yeah, I just thought I'd let you know that, the Office for Aging Services here at DARS was pretty fortunate this budget cycle, once the budget finally got finalized and signed. So we did receive $100,000 to support the senior legal helpline, which we had previously done with the Virginia Poverty Law Center. And I do need to contact them to see if we can begin to start that up again. I was kind of surprised that made it through. We also received $125,000 to expand our senior farmers market nutrition program. And that won't happen until next year. We'll use the funding for next year because this season is already underway. So can't really use it for this year. We also received funding, and my notes just disappeared on me. $600,000 for our Virginia Insurance Counseling and Assistance Program, so that hopefully the AAAs will be able to either hire additional staff or to have their coordinators work full time. So we're excited about that. It's the first time we've ever had any state funding for the VICAP program for Medicare counseling. We received funding for 300 additional public guardianship slots. So that brings our total number of slots up to 1,349. And they also funded a study, which we've not had done since 2007, for us to assess the need for public guardianship in Virginia. And then, of course, we got our continued funding for the Respite Care Initiative program, where we work with 11 providers around the state to provide up to 40 hours a month of respite for caregivers of people with dementia. And that actually will be going out for RFP, hopefully within the next couple of weeks, to see if there are any new additional providers out there. So I realize that only the Respite Care Initiative immediately impacts caregivers. We were really pleased that we were able to get all that funding this year.
Wow, that sounds fantastic. I'm glad that General Assembly is recognizing the need for aging services and actually giving us some funding to do the things that we need to do. So that's awesome. Way better news than the opposite, right? So
Exactly. It just took a long time to get there.
yes, yeah, that's great. Well, thanks for updating. Does anybody have any questions for Kathy about the budget or?
That's amazing.
Yeah. Awesome. Well, that's great news. Good way to start off the meeting, actually, I think. Anybody else have questions or any other final updates before we go to old business?
George put in the comments that DARS also received an additional $112,500 for dementia care coordination.
That's amazing.
That's right. I'm so sorry, George. I thought I got it all, but yeah, I missed one.
No worries, Kathy.
Wow.
That's great. That's awesome.
What would that actually do, George?
So Dee, that is going to add, that adds to the ongoing $150,000 available. And so it's to support dementia care coordination done by UVA's Memory Disorders Clinic in conjunction with the Alzheimer's Association. So the additional funds this year should allow the hiring of a new person, which means at least an additional 38, bringing the total to, I think, 88 or 83 families to be served using state funds.
Wow.
Great. Great.
That's wonderful.
Awesome. And it looks like Donna says that brain injury also received, oh wait, sorry, that's moving on me, about $500,000 additional for case management in areas that are underserved right now for people living with brain injury. So that's great news as well.
Wow.
Awesome. Okay.
That is a
Any-
true blessing. Wow.
I know. Anything else? All right, well, we'll go to old business now. So Nick, if you want to take it away, just giving a little update on the VCC Care Act wallet cards that we've been doing with AARP.
Yeah, so as you know, some of you who've been kind of in the more recent meetings, the VCC, AARP Virginia, the Lindsay Care Institute, and Senior Navigator kind of partnered up on creating these Care Act wallet cards that inform caregivers of their rights when their loved one goes into a hospital. AARP is generously going to provide the cost for printing these cards out, and they're going to distribute it among the 4 groups, and then I can distribute it out to anyone who's interested. I originally thought we were going to get around 2,000 wallet cards, but I was just emailing AARP, and I think we're going to increase that to 4,000. So I'll have 4,000 wallet cards for anyone who may be working, a table at like an expo or something like that. Might be able to distribute them out to the AAAs who are interested in, having those available. I don't know when I will have them. She said that she wanted to get the order in by tomorrow. So I assume sooner rather than later. So probably by the September meeting, I'll be asking people where to mail these things to. But that is all I really have for old business. At least updates on old business.
Awesome. Okay. Well, so I guess now we can go to new business. So I guess the main thing is we do have a new officer board. So I'm now the chair for VCC and taking over for Chris, who has been our chair and has done a great job. So I am honored to be taking his place. And I believe my term is for 3 years, right? Yeah. And so the new priorities for the VCC hopefully will include, setting more agenda priorities and goals, and creating actionable items for the next 3 years. So the executive committee really wants to sit down and kind of create what our new priorities and goals are going to be. Also getting our committee roles and goals defined. We do have a couple of seats, I think, available right now. And so we want to obviously get those filled and make sure that, we're pursuing those various VCC agenda priorities. Also evaluating and updating our bylaws, creating maybe a homepage for the VCC with the help of DARS and Virginia Navigator. I know that's been something that's been in talks for a while now. And then also potentially evaluating our meeting format. So I know, we've been meeting via Zoom, but maybe considering some hybrid options or ways to get us, more involved. And then also just looking at increasing participation in general, trying to look at how we can reach all areas of the state, how we can reach, many different types of caregivers from all over, and really just making sure that people know what the VCC is and how they can join, and really just raising awareness. about what we do. So that's kind of what we're thinking right now. And we are going to be meeting, as an executive committee to look at these priorities and see if we really, want to set these in stone. I know evaluating and updating the bylaws is a big one for us, just because it has been a while, I believe, since they've been updated, and this group has kind of morphed and changed into something that wasn't always necessarily what was in the bylaws originally. So we want to make sure that we're staying current and up to date with the needs of the coalition moving forward. So does anybody have any questions about that in terms of our potential priorities?
Miss Emily,
Yes.
this is Jacqueline Anderson again. Again, I've been out for a little bit, so I'm more than happy to offer assistance in whatever you need me to do. I really miss being with you all and everything, so I just want to get back in there and help as much as I can, okay? So use
Awesome.
me, please.
Yes, yeah. Well, hopefully once we get those, chair or not chairs, the committee chairs, those roles defined, and we kind of know what those are going to look like, we will definitely put out a call for, people who are interested in maybe chairing those committees or even participating in the committees, as just a member. So definitely stay on the lookout for those opportunities, because hopefully we'll get that out soon, and we would love to see everybody involved.
Thank you.
Yeah. Any other comments or questions? All right, and so next would be an update from our vice chair, but she is on maternity leave, so I don't think that she's here today. Yes, but she did want, me to tell everyone that she's very excited to be the vice chair, and once she gets back from maternity leave, she'll definitely be in attendance and everything. Is Chris here today? Chris? No. Okay.
I think he was traveling out of the country.
Okay, gotcha. All right. And then Donna, any updates from the education committee?
I just have, I guess, one. We have the September meeting scheduled for Nick and Liza to do a lifespan respite update. And then I do not have the November meeting scheduled yet, but I'm working on it.
All right, awesome. We currently do not have a membership chair, and I don't think we have any updates there. That will be another opportunity for people. And so now I guess we'll just go into some DARS updates. So Nick.
Okay, me again. So I have a couple updates. I guess some of it applies to my other hat, doing stuff with the area agencies on aging. If you are associated with an area agency on aging, you probably know by now that we are working on updating the service standards, which should hopefully make providing services on your end a little bit easier as to what DARS requires of your agencies. It's a haul. It's a humongous document, and it's some of my stuff for especially the in-home services and the caregiver programs are kind of quite out of date or not clearly defined. So I'm going to be working really hard on getting especially care coordination tightened up, and also some more guidance on the National Family Caregiver Support Program, and a little bit more guidance when it comes to the support groups, individual counseling side of things. So that's kind of what my big priority is for the rest of the year. Also, Kathy and I are working on the state-funded respite care initiative grant that the state provides to DARS to distribute out. We're still in talks with our procurement department on getting this. I don't even know if it's going to be an RFP or an INB or whatever they're called out. Our deadline is like the end of September, and we've already pushed it out a year as it is. So we're really trying to get this done, kind of working with what we got. So the last update I have is Liza is going to be leaving us on August 5th. So this is her last VCC meeting. So I'm going to be at it alone for a little while. It's been wonderful working with her. And I'll hate to see her go. But I'm very excited. She's going to be doing some polling and data analysis work at YouGov Blue. So we're very, very excited for her.
Congratulations.
So, but it's been wonderful having her as part of the team. And I hope she got a lot out of, working with DARS. And
Yes, of course.
so that's all I have on my end.
All right. Well, Liza, do you have any updates about the Virginia Lifespan Respite Grant or anything like that?
Nothing too specific right now. I know as of last week, there's 413 people approved in this grant so far. This week it'll probably be above 430. Reimbursements are going well. We were looking at the data for 2021, right? Because that's year one.
Yeah, grant year one.
And it was 64% of the people approved for the program got reimbursement, which is higher than previous grant years, which was about 50%. So people are getting reimbursed and we're very excited about that. And the program's going well, just getting things in order, making it more efficient.
Yeah.
Is there anything else?
All I know is that we meet with Dr. Laura Sands at Virginia Tech. She's doing a lot of the analysis on the back end, and we were just going over the data yesterday in our weekly meeting with her, and there was 87 people were considered year one for us because we had a late start. So that's kind of our data set for year one that we're going to be analyzing over the next month and a half. So probably my September presentation will deal with that data.
Perfect.
What we've kind of learned from the first year and kind of the changes we've made and what we're going to look like going forward. So,
and we're hitting those targets, which is exciting.
Yeah, we're moving along pretty well. I mean, the goal is 1,000 caregivers over 5 years reimbursed.
Wow.
And if we can get that reimbursement rate up, I'd love to see 75% would be like an awesome goal, which would be a marked improvement over the last grant, which was, like I said, about 50% reimbursement, which is pretty hard because, if the goal was 400, you'd have to approve 800 people to hit that target. So,
right.
It's going well.
That's good. Yeah, we'll look forward to hearing more about that in September. And Liza, sad to hear that you're leaving, but we've enjoyed working with you.
I remembered, I don't know why I forgot. Senior Cool Care, which I'm also helping Kelly Wright with. It's going super well. We started earlier this year and we extended it out until the end of October. And from this time last year to now, it's much lower balance than previous years from this month this year to that month last year. So we're really going through the funds, and we hopefully have some exciting news to share at some point with the AAAs. So it's going very well. We're using that money.
and that's point of contact, right?
Yeah.
For the program. If you're interested in the program, reach out to your local area agency on aging for more information.
Very cool. All right. Well, next is George Worthington. George, do you have any updates for us with dementia services?
Thanks, Emily. I do have a quick one. It's a little bit of an ask for everybody. So the Alzheimer's Disease and Related Disorders Commission is working towards putting on a dementia summit next May. I'll be sending out a save the date for that shortly in the next week or so. But I wanted to, one of the things the committee working on the summit was interested in finding out from you as members of the Virginia Caregiver Coalition is what are the top 3 asks or needs that you hear from caregivers of people living with dementia or other cognitive impairment. And if you're comfortable putting those in the chat, so top 3, just list them 1, 2, 3, and that'll just give me a quick sense of what the needs are. We feel like we have a sense, since many of the folks on the committee work.
I think George froze. Did he freeze just for me or other people too? Okay.
Yeah, I think he's frozen.
Okay, well, I think, yeah, he just wanted to, oh, he dropped off. All right. But yeah, if you guys could just put in the chat 3 things that you hear from dementia caregivers about what their needs are, that would be great, just to help him out with that.
Yeah, I'm gonna.
So I'll give like a couple, maybe, because you might not be able to think of it right off the bat. So I might give like 2 minutes just for us to think about that and put it in the chat if you feel comfortable.
I want to say
pile all
something.
that.
Yeah, go ahead.
Because if I put it in the chat, it may not be understood exactly. And this is not what I'm asked for, but after a lengthy consultation, it comes out that the caregiver desperately needs respite, but they don't know that word.
No.
And they're often unwilling to even explore it.
Right.
That's something I think that really needs more education around. And the flyer, Nick, that you have for the DARS respite thing, I mean, I think we should really push that out. I hadn't really seen it. I had been given that information verbally to people, but the flyer has been very helpful. Also, a lack of understanding on what dementia is. I have to do a lot of education with caregivers once they get a diagnosis, to ask them, what kind of dementia were you given? What treatment were you, what prescription was provided? Anything like that. They don't understand that piece. And the other thing that became really apparent to me was the lack of self-care that caregivers are giving themselves through this Jenkins grant that we recently did. It took a long time to get caregivers to the point where they could even say, I need, and finish that sentence.
Yeah.
So I think we're not doing a good job when we just say self-care. Then they blow it off right there. So we need to come up with some better terminology and some concrete messaging around the reciprocity of the caregiver role, that there's give and take.
Yeah.
I'd also like to mention, I have, this was a recent experience. I have a close friend who's caring for a young child, and also her husband, who has brain tumors and has had multiple surgeries and has some cognitive issues because of that. And she was able to spend some time with me while I was up in New York recently. And for her to even say that she deserved that time and not feel guilty about taking a break, so she could kind of, I even said, I was like, you have to take care of yourself too. You have to be able to put yourself first. You have to be able to allocate time, and you can't feel guilty about doing that. You want to be the best caregiver you can be, and that requires your tanks to be full, and you need to take the time to fill them back up again. So I just thought that.
But they can't do it without the right support.
Yeah, and that was a challenge too, because now she's one income household, also taking care of a child where he's unable to assist her now. So it's a lot of pressure on her immediate family because it's not very big. So
yeah, they need education on where to get support and what that support looks like, so that then they can have a plan of care too.
Yeah, and I mean, also she's a dual care. She's also in the medical field. She's a nurse in an ER, so it's kind of on all sides for her.
I've been talking to our caregivers and support groups, for a long time, people are like, let it go, take care of yourself, self-care, but nobody tells us how to do that, right? I was watching them teach children mindfulness, and I was sitting there like a child. It's like, you know, it's taking people back for generations. Nobody talks about things. The elders I serve in the rural areas, they, you know, pull up their pants and do the work. It doesn't matter how long they have to do it. They just work through it. And so when I tell these seniors, like, you know, affirmations, like they laugh at me, you know, like these are things that they've never even heard of. And it's hard for them to understand, like to give an hour to yourself a day when they have never done that. They never saw their parents do that. And I think that there's a lot of ties in with the mental health piece of this. You know, we're learning a lot about mental health and it ties right in with what we're doing for caregivers. But it's like almost to another level, right? It's like people don't even understand. I had to talk to a lady for 6 months to take an hour a week for herself, you know, and once she started doing that, she didn't sob anymore every time I saw her. And I think it's like challenging them to do little things that I learned how to take care of myself through COVID. You know, and it was just like I had to learn who I was and what I enjoy and just figuring that out. And so that's a whole nother piece of this, right? So anyway, sorry.
No, Miss Arthur, you're absolutely right, because I'm not going to take up a lot of everybody's time, but that's exactly what happened to me. I was ignoring my health and putting everybody first. And unfortunately, one day I was on my way again, running to take my son before he went to his job, and my legs gave out on me in the hallway, and my blood sugar when they got me to the hospital was 1112, and I had no idea that I was dealing with a diabetic situation, because as a single mother and grandmother with a son who has been shaken by his mother, not my daughter, but my daughter-in-law. I've had him since he was 4 months old, and he's now been classified cerebral palsy due to his shaken baby syndrome and all of the cognitive issues and other things that he's dealing with. It's been really hard for me to put my focus on me because his needs outweigh mine. And it's really difficult when you're forced physically to sit down and take care of yourself, and then you realize you don't know what to do. It's a very scary thing. And while I was in the hospital, those 4 or 5 months, crying and being regretful because I wasn't able to be here with him and for him, it became, sorry, I get a little choked up, that you have to take care of you, because when you break down, who's going to care for the ones you've been caring for? So it is extremely important that you have to put yourself first in order to be able to be there for the ones you love and the ones you need to care about. So, I'm sorry. Sorry about that. And that's why I think that everything you guys are doing is so amazing. And that's why I want to be able to come in and help someone to not be in this situation that I found myself in, because it's very easy to get there, but it's hard to bring yourself back out of that. And wow, oh, wow. Sorry about that.
No, thank you for sharing. It's a perfect example of what we've been talking about. And, you know, it's hard for caregivers, I think, to take a step back and think about it from, you know, when you're living day to day and hour to hour and maybe even minute to minute, it's hard to see that big picture of, if I don't take care of myself, then nobody's going to be there to care for my loved one. And that actually was a research study that I helped, you know, and I talked to a lot of caregivers, and that was a big concern for a lot of them, was like, what happens to them if something happens to me? But it's hard to navigate doing that when you're down in the trenches of it every single day. So I think that, you know, just goes to show how important it is for us to really, you know, do outreach to caregivers and, you know, provide resources and education and help navigating some of these tough things. Because
absolutely. And the guilt is definitely there, because, you know, I found myself if I do something for myself, then I have to do something for everybody that I'm caring for, because I don't really feel worthy of, I mean, it's my job. I'm supposed to do this. So, so I
Yeah.
did after I got out the hospital, I found myself at the Dollar Tree. So I bought myself a little trinket for every day of the month. It's only $1, a dollar item, just to say, appreciate me and thank you. And my spiritual side has really stepped into my forefront, because, you have to have the gratitude, and then you have to have the right attitude in order to increase your altitude. Because without those 3 twos, then you're really going to be messed up. So, yeah, I mean, it's wow. I'm just really
Yeah.
going to pay a lot more attention and try to help as many people as I can help to not go down that same road that I went down, because it's a slippery slope. And once you start sliding, it's hard to pull yourself back up until you hit bottom.
Yep. Yeah, for sure.
Thank you so much, Jacqueline, for sharing all that.
Thank
And
you all.
it
Y'all
really
made me
puts a
feel
human
so
face
happy.
on what we're trying to do. And
Thank you.
thanks to everybody else for for what they put in the chat. That's really going to be super helpful for my committee. So I appreciate it.
Yes. Yeah, George, you'll have to keep us updated on what you guys end up doing with all the feedback.
Definitely.
Yes, I will. Thanks.
Yes. Awesome. Well, now I think we're going to move into, because Kathy already gave her update. So is Donna back on the call yet? No. Okay. So I will just introduce Annie, who is going to be our educational speaker. Hi, Annie. So Annie is the Brain Health Triage Coordinator for the Richmond Brain Health Institute. She's also an instructor in the Master's Program and Research Analyst for the Virginia Center on Aging. She has been awarded for her work in inclusive gerontology, is a 2018 Age Wave Scholar, and a 2021 VCU 10 under 10 honoree. And she currently serves as the chairperson for the Public Policy and Advocacy Committee for the Southern Gerontological Society. So we're so happy to have Annie with us today and sharing a little bit about what she does.
Good morning, everybody. Thank you for having me. And if it's okay, I'm going to share my screen because I do have a presentation. And if someone would be willing to monitor the chat for me while I share the screen, because it can get a little complicated to do both of those things on Zoom, that will be great. Thank you so much. And this works. I hope everyone is having a good morning. I am in a clinical environment today presenting, so I'm going to keep my mask on for everybody's safety. And if you see people walking around behind me, pay them no mind. They know that I'm presenting. Okay.
Do you need to be made co-host, Annie?
No, I think I've got it. I think
Okay.
I've got it, and I'm presenting. Hopefully. All right, is that a nice presenter view? Everyone see my presentation?
Yes. Yes.
Okay, very good. So yes, so you can see the cover slide should say VCU Richmond Brain Health Initiative, RBHI.
Yeah, we also see the sidebar with the slides and document recovery.
Oh, I see. Well, I don't love that. Let's try this one. How is that?
There we go.
That's better. Yes.
And when I move, when I move
Yes.
slides, are you seeing a move? Okay, great.
Yep, you're good.
Thank you so much. So yeah, I'm Annie, and I am talking today about the Richmond Brain Health Initiative, which we call RBHI. Now, really important, it's called the Richmond Brain Health Initiative, but our services are open to anybody in Virginia of any age. Because just like folks were saying, we understand that people in rural areas, people outside of the greater Richmond area, they need services just like the people inside the greater Richmond area do. So it's called RBHI, and that's because of the relationship with VCU, but anybody can access these services. And similarly, any age group can access these services because we know that dementia can happen to people at any age. And we also know that the risk factors for dementia start very early in life. So I just want to say those two things. I'm famous for forgetting to say them, so I like to say them in the beginning. And we're going to talk about two main things today. We're going to talk about what is the Richmond Brain Health Initiative and our services. And we have 3 services, which I'm going to go over very briefly: care navigation, health coaching, and care consultation. But we're going to focus primarily on our caregiver support program today. So I will tell you about all of our services, but we're going to focus on what we provide to caregivers. And then we're also going to talk about the Virginia Memory Care Project, which, if you've heard me present before, you might have heard me call it VADER, but we're calling it the Virginia Memory Project. And we're going to talk a little bit about that and how to enroll and why it's important. Okay. And feel free to put questions in the chat and I will address them at the end, unless there's something urgent, in which case my chat monitor will let me know. So I'm going to start, now that you know about the 3 services that we provide at the Richmond Brain Health Initiative, I want to start by saying what the Virginia Memory Project is. And the Virginia Memory Project is a comprehensive, or we're aiming to be a comprehensive catalog of epidemiological data for health and caregiving in the Commonwealth. We also connect anyone to caregiving or brain health services through RBHI upon request. So the Virginia Memory Project and RBHI have a very synergistic relationship. And what's nice is that folks, even if you're not trying to access services at this time, but you want to help get data to legislators and epidemiologists about caregiving and dementia, you can still support our efforts. So everyone's action step today at the end of my presentation is going to be, you're going to help us in some way, right? You're either going to get the help that you need for yourself or you need for your clients, and you're also maybe going to help us get some data, okay? Because it takes a village to get this initiative and get the services that we need for caregivers. Mm-hmm. So, like I alluded to a little bit earlier, Richmond Brain Health Initiative is a team of VCU professionals that provide brain health and memory support care. We are part of VCU gerontology, nursing, geriatrics, and neurology. So we are an interdisciplinary team of highly trained professionals. So we strive to improve the quality of life for those who are at risk of memory and brain health needs, or those at risk of memory loss or who have brain health needs, those who are living with memory or brain health loss or needs, and those who are caring for someone living with memory or brain health needs. And so we're going to really focus on the caring part today, but those are the ways in which we are trying to improve the quality of life. We also provide educational support to the community, because just like Dee was saying, we see the same thing. Once you get the dementia word, people don't know what that means. A lot of times doctors write it on a chart and they don't even adequately or explain it to the caregiver or to the person living with dementia. So we also provide direct education about dementia, about brain health, to people who maybe don't currently have a concern, but need to know about it so they can take charge of their own health. We connect and refer community members to local brain health resources and services. And local means wherever you are. So I had somebody call me from Berryville the other day. So we're working together to find her resources in Berryville. Okay. Local means where they are. We don't expect people to come to us. We want to come to them. All of our services are accessible through the telephone. And because it's accessible through the telephone, it makes us able to help those rural folks. So everything that we offer at RBHI is completely free of charge and accessible to anybody of any age, okay? We are able to do this because we got a grant from the Administration of Community Living. So how we determine if there are services that are appropriate, we'll conduct a brain health screening to anybody who asks for one. And that determines if your eligibility, and it also determines what risk factors you might be experiencing, because we know that up to 40% of dementia cases are preventable, but the effort of prevention needs to start very early in life. So depending on what your risk factors are or what's going on, we might direct you to care navigation, to health coaching, to care consultation, or to education, okay? And this is a little bit more of a detailed schematic of our layout to our different pathways to services. So for folks who are sort of in the MCI area, they're going to go into our care navigation program. For those who are living with a risk of a brain health need, or maybe have some risk factors for dementia, they're going to go into our health coaching program. And for those folks who are living with their caregiver, or folks who maybe aren't living with their caregiver, but are getting intensive support from caregivers with a diagnosis of dementia, or who've already screened, or who screen with us for having cognitive impairment, they're going to go into our care consultation program. And that supports dyads, okay? That supports the person living with dementia and the caregiver simultaneously as a unit, because to Dee's point, there's give and take, and we want to get our arms around both of them, okay? So why are these services important? And I think I'm preaching to the choir a little bit here, so I'll rush through this. But there are potentially, there are modifiable risk factors for dementia, right? And we do know that by addressing those risk factors, we can prevent some cases. We can also delay the progression of other cases. And we are very focused on supporting the person who already has that diagnosis of dementia, but being a caregiver is a risk factor for dementia. So we are also very focused on preventing cases of dementia in people who are caregivers. You can see here throughout the life, all of the different modifiable risk factors that contribute to dementia. And if we were to ameliorate or eliminate them, our total global reduction in dementia prevalence. So in Virginia, thinking a little bit more local, we see that over 300,000 Virginians over the age of 45 may be living with cognitive impairment, but a lot of them haven't talked to a physician about this. So RBHI is able to sort of be the bridge between the person living with a brain health concern or a memory concern, and if that person wants to access clinical services. If they don't want to access clinical services, then RBHI is going to really focus on how to reduce their risk factors and help them reflect on if they need to be paying attention to this and maybe in the future plan for clinical assessment. And so you see all over the state, we have fee-for-service Medicare beneficiaries diagnosed with Alzheimer's disease. So we would call Richmond and Virginia sort of a brain health desert. And I don't love that term, but I think when I use it, you know what I'm talking about, because there is not frequent and strong access to memory care services. I think EVMS has a memory care clinic, UVA has a memory care clinic, but these are very clinically focused, obviously, because they're in hospital systems. There's not a lot of support for caregivers and for people living with dementia out in the community. And similarly, we don't have good data. We don't really know how many caregivers there are. We don't really know how many people with dementia who aren't on Medicare. We don't know how many there are. Skip over some of these because I think I'm talking to a group that understands. So I really want to focus on how RBHI will serve anybody across the continuum of brain health needs or Alzheimer's disease. Okay, that includes preclinical, where there are no symptoms, mild or no symptoms, but possible biological changes in the brain. That would be, maybe we see some risk factors, mild cognitive impairment, dementia at any of the stages. We will serve any of those folks at any age for no cost. Okay. So I'm going to focus now on the care consultation program because we have health coaching and we have care navigation, but those are really focused on people who aren't in care dyads. So we're going to spend a little bit of time talking about care consultation. And BRI stands for Benjamin Rose Institute. And if folks want to, they can put a little thumbs up in the using the emoji to let me know if you've ever heard of the Benjamin Rose Institute. Or a thumbs down. I don't know if there's a thumbs down emoji in Zoom, but there should be. Emily's heard of it. Fantastic. So Benjamin Rose Institute is, oh, and Kimberly's heard of it. Very good. George has heard of it. So Benjamin Rose Institute is that evidence-based program supporting dyads. And we have that here at the Richmond Brain Health Initiative. And it's 9 to 12 month long structured support for an individual living with memory or brain health concerns and their caregivers. Okay, folks come in together. It is unique in that it's interested in uplifting and getting their arms around the caregiver and the person living with dementia simultaneously. With a BRA care consultation, your dyad is going to learn how to organize family care and support. So talking about things like respite, brainstorming, finding transportation solutions, all of that stuff is happening together. They're going to anticipate what to expect with dementia or memory needs because they're going to get lots of education for both the person living with dementia and the caregiver. We all know, as people who are supporting this population, that the surprises are what make it really hard. Okay, that's what puts people into crisis. The more we're able to plan, the less crisis we have. And we're also working on just the functional aspects of living with dementia and being in a care dyad. So how to take care of ADLs, how to make sure that we're not emptying our own cup because we're taking care of somebody, how to plan both short-term and long-term. And it's 9 to 12 months long, and it can be done completely over the telephone because I don't want caregivers driving all over the state. They already have to do that for doctor's appointments. So we do it over the telephone. BRI, care consultation, and this is very important. It's a question I get a lot. It is evidence-based. It is comprehensive, okay? It's not something that we have made up. It has been tested again and again and again, and we consistently see very good outcomes for both members of the dyad. So that's why we have chosen BRI, care consultation, as the dyad support program for Richmond Brain Health Initiative. There are lots, there are many that are very good. BRI is one of the gold standards. Care consultation is unique because it focuses and uses a holistic approach. We know that dementia is a neurodegenerative disorder. We know that there are a lot of clinical aspects, but we also know that people need to be taken care of psychologically, emotionally, spiritually, socially. And so we focus on care consultation on medical and non-medical issues. And like I said, we're getting our arms around both members of the dyad over a long-term period of time. This is not a one and done. This is a year of follow-up from your care consultation person at the Benjamin Rose Institute program. And like I said, it's very effective. We see reduced symptoms of depression. We see less caregiver strain, less relationship strain between caregiver and person receiving care. And we see that there is a reduction in costs because we're not going into crisis, so we're not going to the emergency room. All right, we're not needing to go to the hospital so much. And BRI is part of a three-part framework for success. It has a three-part framework for success. But even though it's a framework and it is a program with a lot of aspects to it, there's still a lot of flexibility that allows us to be very person-centered, both for the person living with dementia and their care partner. So part one, for someone coming into the Benjamin Rose Institute Care Consultation Program through RBHI, is we're going to assess. We're going to assess both the caregiver and the person living with dementia to see what needs we think there are and what needs the person living with dementia thinks there are, the care partner thinks there are. And we're going to support open dialogue between both of those parties because it can be really hard when you're busy just trying to get people fed and dressed and to doctor's appointments and do ADLs to encourage open dialogues, and things become very strained. It can be very helpful to just have a mediator in that conversation. We're also going to make action plans, and that includes the recommendations about solution problem solving, guidance on resources, and in the moment challenging behavior resolutions, kind of working with the dementia with behavioral or psychiatric symptoms. And then, like I said, it's ongoing 9 to 12 months. And then generally we keep families in the system so that if something changes, they can reach back out. You don't have to tell your story all over again, okay? So this is just a model of what I've just talked about. So after assessment, if you were to call into the Richmond Brain Health Institute and say, I'm part of a care dyad, or I have a client who has a care dyad, I want to see if we can get them into this program, then you would be assessed most likely by myself, or there's another person who works in our program called Kennedy O'Donnell. You'd be assessed, and we would determine if you were a good fit for the program. And at that point, we're going to refer you to a BRI specialist And our BRI specialist is a clinical social worker who works out of Riverside. And so that would be the person that the dyad would be working with on sort of a more frequent basis and getting the maintenance and support, the reassessments, and the action plan. And then that's just kind of it. We look on long-term care planning or long-term solutions, long-term, which can include long-term care planning, but long-term solutions for our problems. This is some information about the effectiveness of the program. And like I said, you see reduction in depression, reduction in relationship strain, slowing of health deterioration, and improved efficacy for both the person living with dementia and the caregiver. It's a very effective program because when people have the support and the connections to resources they need, they do better. So some outcomes I'm going to highlight with some numbers. You can tell we're a little academic over here because we always have our sources. But we saw 64 point, well, in these clinical trials of the Benjamin Rose Institute, we see a 64.8% decrease in perceived unmet needs. Okay, that's huge because every meeting I have with people with dementia or with caregivers, they're telling me about their unmet needs, okay, and how they do not know where to go for support. And just like Dee and so many of you were putting in the chat, people don't know where to go. People don't know the words to use. People don't know the resources that are available. People don't know where to start. Now contrast that over a typical year without intervention, we're going to see an increase in unmet needs. But with intervention, we're going to see a significant decrease. Now, and that was for the person living with dementia. Now with caregivers, we see a 35.4% decrease in unmet caregiver needs, which is awesome. Just think about, for those of you who are caregivers or supporting caregivers, if you were able to take off 35% of their burden, okay? That's what we do. That's what we do. And then relationship strain. We love to see the relationship go back to what it is, right? A loving relationship, spousal, friends, family. We want to restore that and we want to protect that, okay? And so we see relationship strain decrease and we see sort of that, the bonds restored in BRI. And that's what makes it such a lovely program because of those holistic, the holistic approach and really taking that person-centered biopsychosocial spiritual idea for both members of the dyad. We see the relationship restored, which is wonderful and so important in long-term dementia care. I'm gonna go through because I think you all get it. It's a really good program. So BRI care consultation in summary, there's 2 decades of really strong research, and it's been proven to provide ongoing coaching and support needed for people with chronic brain conditions and their family caregivers. The beneficial impacts of BRI care consultation work at any stage or level of severity. So we have folks who are coming in and it's a relatively new diagnosis. We're at the mild stages or moderate stages. We see BRI be effective. Similarly, for people who are moderate stage dementia and maybe the caregiver is taking on more of that work, we still see this program to be effective. The earlier, the better, because we want to get as much input and voice and choice for the person living with dementia into our assessment. But at any time, folks can come to this program. I wouldn't want you to hesitate about referring yourself or someone that you're supporting because you thought that their brain health needs were too early or too late, okay? So health coaching, I left this in here. We're not going to talk about it for too much because I really wanted to focus on the caregiver support. But Richmond Brain Health Initiative also offers health coaching to folks that currently do not have a brain health diagnosis, but have a brain health concern or have brain health and dementia risk factors. And like I said before, caregiving is a risk factor for dementia. Why? People aren't going to the doctor. People are incredibly stressed. There's depression. Sometimes there's substance use, okay? So health coaching is available for our caregivers who just need maybe something for themselves, okay? It reduces the risk for memory and brain health impairment. And it also addresses present needs and future needs, because we know that caregivers, they're not putting themselves first, right? They're putting the person they take care of first, but they need a plan for their long-term care, okay, or their long-term health. So health coaching is available if the caregiver needs something just for themselves, okay? And you can get both of these services from the Richmond Brain Health Initiative. We offer our spectrum of services. If you're eligible for it, we want to provide it to you. So now I want to talk a little bit about the Virginia Memory Project, which I alluded to earlier, and that's our registry that goes in tandem with the Richmond Brain Health Initiative. Now, the Virginia Memory Project is funded by the Virginia Department of Health, because those figures that I showed you earlier about folks with cognitive, folks with memory decline, who haven't talked to a doctor, all of that comes from Medicare data, but we don't have very good granular data for the different areas of Virginia. And so we actually don't know how many people are caregivers. We actually don't know how many people are struggling with a brain health concern or a memory loss concern. So the Virginia Memory Project helps us encapsulate that data so that people the folks at DARS, like George, they can go and advocate for more money, more services, because we have the data to back it up. So that's the Virginia Memory Project. Virginia Memory Project, same staff, same idea as Richmond Brain Health Initiative. It's just two different names because it's two different funders. So why we added a registry to the Richmond Brain Health Initiative, or why we started Virginia Memory Project, is because we see that long-term data on caregiving and dementia really helps be cost-effective and reduces disease long-term. And the reason it reduces disease long-term is because if we can identify caregiving hotspots or brain health disorder hotspots, then we can advocate for money to give more services in those areas. So long-term, they are incredibly cost-effective. In fact, for every $1 you spend, you get $10 back in a disease registry, okay? And so, like I said before, the Virginia Memory Project is generously supported by Healthy Brain Virginia, which is part of the BOLD Fund and DARS and Virginia Department of Health. And we are looking to support these sort of concrete objectives in the dementia roadmap for Healthy Brain Virginia. So we're integrating the available evidence into existing health communications. We're helping caregivers, if they come to the Virginia Memory Project, get connected to RBHI. And then we're using that data to support long-term trend forecasting, okay? So for the Virginia Memory Project, it is an extension of BRFIS, okay? And if you've ever had somebody from the CDC call you and ask you questions about your behavioral risk factors, that's BRFIS. And BRFIS has two modules that are really relevant to this group. They have a module about memory loss, and they have a module about caregiving. And so what we did was we adapted those two modules. They're very, very short, and we just made them accessible via mobile, okay? And that data, you don't have to give your name. The people you refer, they don't have to give their name. They can if they'd like to get connected to services. They just give us their zip code. They give us any concerns they're having, or if they're not having concerns, that's awesome too, because that helps us understand where the hotspots are. And we can then support the Department of Health and support DARS to get more resources where they're needed. And we just ask about cognition and about caregiving, and the whole thing can be done in about 2 minutes, I think is how fast I've timed it. So if you want to help the Virginia Memory Project, because you're not quite ready to get into a Richmond Brain Health Initiative, but if you still want to support our work, then you can enroll in the Virginia Memory Project. And you can also, if those of you who have newsletters, who teach classes, please let folks know about this service. They're both very new, the Virginia Memory Project and the Richmond Brain Health Initiative, and really get the word out, because we need to demonstrate that this service is so needed and so sought after, so that we can continue to expand it. I will send afterwards some communications materials for folks, flyers, little code blurbs that you can embed if you have a Facebook page or a Twitter page. And then also please provide input to either campaign, the Virginia Memory Project campaign or to the Richmond Brain Health Initiative campaign. We're very new. We kicked off in January, and we are continuously trying to make sure that we are responsive to the community. And this QR code that you see in the corner, you can scan that on your phone if you want to enroll in the Virginia Memory Project right now. It will take 2 minutes, and it's also a way to get connected to the Richmond Brain Health Initiative. So you'll see our staff right here. I talked about it a little bit earlier. So Dr. Faika Zanchani is Dr. Faika Zanchani, she works in the Department of Gerontology. She is our gerontologist, senior gerontologist. And then we have Lana Sargent, who is nursing and geriatrics. And then we have Brian Berman, who is our director looking at neurology and medicine. And then I'm your humble brain health triage coordinator right here. And then Kennedy, who I talked about earlier, is another interventionist. So the 5 of us together, we are the Richmond Brain Health Initiative and the Virginia Memory Project. And so please feel free to contact us. And like I said, I will send this all out to be shared along with some Virginia Memory Project information, but this is a great flyer. Oh, I went a little fast. This is a great flyer on your screen that shows a little bit about what we do, okay? And also the QR code there is to get connected to services. For folks who aren't on the internet, we have a phone number, we have a brain health hotline. We want to help and we want to be as accessible as possible. And with that, I am going to open it up for questions. I don't know how much time we have, but I would love to be able to take some if I can.
Any questions for Annie?
I think there was a couple questions in the chat.
And Annie, I want to say thank you. I did work with you all already, and that was really great. But for us as providers, can you share with everyone how it's best to make a referral to this group?
I would say via email or via that QR code, if you can. I can also send out a another link if you would like, but that QR code will get folks in. What other question? Did I do this such a good job that I didn't have any questions? I will send out my email is here. I think. No, it's not. Okay. I will send out my direct email for those of you who want to contact. Okay. Yes. I'm so glad we have some interest in getting services. Perfect in the chat. And so if anyone who's interested in getting services from me or talking about a personal brain health concern, I would suggest either emailing or calling. And I'm going to put my personal email in the chat so you can also get to me that way. And that way we can follow up with you privately.
Annie, I just want to say thank you for your presentation. I work with the local agency on aging, like, in the Northern Neck Middle Peninsula. And so we have been talking to caregivers and referring them to the Benjamin Rouse Institute on Aging because we have the We Care program grants. And I was telling our directors, because what I was facing was people didn't want to call, but I thought it was like, just for the Institute. But then I was realizing, and I told my director that they don't even want to talk to me. It takes like a little while, sometimes over a year, for them to even open up and talk about it. And what I found is one of the Institute's coordinators said to me, it's all in how you say it. Could we change it up and say, well, this isn't someone that's not from our area that you can be confidential with and talk to? Because I'll have people get on a support group and they're like, no, I can't stay. My neighbor's on the call. And I'm like, well, you're both dealing with the same thing. But we're seeing, like, in the rural areas, they just don't want to air out their dirty laundry. They don't like to talk about it. And I feel like they reach like a breaking point, or they get in the fire of it, and then they want to reach out for help. And so, it's all this evolving into just the education piece first, reducing the stigma. And I'm hoping that in the year to come that, people will just be more open to talking about it, hearing the resources that are available, and not thinking that they're putting their information out there, you know. So that's some of the challenges I've faced with trying to talk about the consultations. And but I like the thing about like just changing the way we introduce it. And so anyway.
I'm so glad for that comment, because you bring up another really good point that I want to talk about, which is that we offer connection to clinical services. We offer getting diagnosed. We offer getting into your medical record and putting that information in there. But we also understand that dementia is a very stigmatizing condition, and some people are very fearful of the label. And so if you access services from us, we don't chart on you in your medical record. You know, none of the health systems ever have to know we are VCU, but we're VCU University. We're connected to the health system, but you don't need, we can start it really gently, and people can come and talk to us without fear that they will have a label that follows them around for the rest of their life. We are very passionate also about getting proper diagnosis, because it's easy to just look at a MOCA and then label someone with dementia, but that's not best practice. That is just a screening. And so we are very passionate about, if someone is going to pursue a clinical service or clinical assessment, that we're going to make sure it's someone we trust, it's someone we have an ongoing dialogue with, and that it's someone who's going to get an accurate diagnosis. Let's say that. I think we've all probably seen some questionable diagnoses.
Hi, Annie. I post on the AARP Family Caregiver Facebook page certain resources, but that is I'm sure people from all over the country. So I'm making an assumption this is only for Virginia residents.
Only for Virginia right now. Yes. Yes.
And
only for Virginia.
do you know of resources in other states that provide the same type of support?
So that's a great question. So there are some sort of other Benjamin Rose Institute pop-ups in other states. There are some kind of share and caregiver institutions. It would be a really good thing for us to work on compiling a list. Now that I'm thinking about it, if you come to us from out of state, to see where we could refer you. I would still, if it's somebody who really wants to get connected, I would encourage them to still send us an email, and we'll see what we can find. You know, we're kind of looped into this caregiver support network. We're looped in with ACL. We might be able to find something back to them really quickly. I'm a big proponent of no wrong door, right? Both the system, but also no wrong door, in that if you come and you tell your story, we're going to do what we can to help you. And we do not have, oh, sorry, go ahead.
I'm sorry, I'll mention that it is for Virginia residents. However, you may be able to provide resources outside Virginia.
I think that's the perfect way to say it. Yeah, right now our services are limited. Yeah. And I don't have support groups for caregivers. We don't have the sort of bandwidth for that right now, but what we would do is help you get connected to a support group for caregivers. Dee has a wonderful list that she maintains, and we would help you get connected to a support group. We hope someday that we can do support groups. It's just not where we are yet. And yes, concerned family members can reach out to me. I won't, admit somebody who doesn't know about it, but we can definitely have a conversation. I encourage it because that person is the caregiver a lot of times, and they know what's going on and they have a reason to be concerned. And we want to address that. Like I said, I don't want there to ever be a wrong door. Please come to us and let us know what's going on, and we can always give you next steps. Always. If we're not the right person, then we'll find you who is.
This is really great information. This is Donna, Annie, and I am so sorry I missed the beginning of your presentation. I had a conflicting meeting. I heard the end of it though, and I saw the questions that came in the chat, and it sounds like really great information. And I'm looking forward to learning more about it.
Yes, we're really excited. It's been extremely well received. Just in the 6 months we've been up and running, and then the 3 months we've kind of been seeing clients, that it's clear that the way to really address people with brain health concerns, or the need for brain health, is
Right.
two people at a time, right? The person with the concern and the person who's caring for them. Okay.
Right.
And it's really wonderful, me personally, with the Virginia Memory Project and things like that. I love when we get dyads who are multi-generational, because I really am, we're focused on making a generation of Virginians without brain health concerns, right? And uplifting 2 generations at a time.
Right. Thank you very much.
Mhm.
Emily, thank you for pinch hitting for me. And I won't have to step out next time. I'm sorry.
It's okay. No, it's no big deal. Well, thank you, Annie, so much for presenting for us today. It was great, just to learn more about what you guys are offering and some of the opportunities. And we'll make sure that we get that flyer out to with the meeting minutes as well. That way everybody can have all the information on how to contact you and how to get in touch.
Perfect. Yes. Who should I send information to? Should it be you, Emily, or
Send it
Donna?
to Nick.
Send it to Nick. Okay.
Yeah.
Yes. He's my friend. We talk a lot. He helped me get the link into this meeting. Thank you, Nick. I will send it to you.
No problem.
Okay. All right, you folks have my email address, and I will send everything else out, and it'll come with the meeting minutes. And in the meantime, there's the QR code in the website, and everyone's call to action is to do something about Virginia brain health today. If you're taking the 2-minute survey to get in the Virginia Memory Project, fantastic. If you're helping someone enroll in services, fantastic. If you're enrolling in services, fantastic. Okay.
Thank you, Annie. All right, well, that was a really cool presentation. Hope you guys will take advantage of that. So now we're just, looking at the conclusion of our meeting and looking forward to our future meetings. We hope that you'll join us for all the rest of our meetings in 2022. There are hyperlinks for the Zoom registration for all of the year's meetings at the bottom of each meeting flyer that goes out, and on the meeting schedule as well. So you can register for all of our meetings this year right now and get them on your calendar. The next one is September 15th, and then after that we will meet on November 17th. All of our meetings are recorded again and uploaded to YouTube, so if for some reason you're not able to come, you can still stay up to date on what we're doing. But yeah, we really thank you all for joining us today, and we hope that we will see you all on September 15th for our next meeting.
Thanks, Emily.
Thanks, everybody.
And by the way, good job on your first meeting as chair.
Yeah.
Thank you.
Yes. Well done.
So proud of you.
Good seeing y'all.
Bye, everyone.